Hello, hello. Welcome to another episode of Not Your Enemy Speak Out Sessions. I'm your girl Shannon with the amazing Jared L. White. How are
What
you
up,
doing?
y'all? Happy Saturday.
Happy Saturday. How you doing?
I'm feeling good, feeling great. Another good show. I'm ready.
I'm excited.
So happy
So
to see you, even though I talk to you every freaking day.
literally every day, but
Every day, all day.
so today is something special. I'm really excited for today because we decided to do a health edition of Not Your Enemy Speak Out Sessions, and I couldn't think of anybody better to start it off, kick it off than my amazing cousin. I've known her whole life. Um, she is she has a bachelor's in nursing and is in the process of getting her master's as well. So welcome, Taylor. How are you?
Good.
Welcome, Taylor. How you doing?
Jared, hey Shannon. How are you guys?
I'm
Good.
good. We're gonna need you to talk louder.
Oh, you can't
Okay.
hear me? Sorry. Let me turn it up a notch.
No.
Yeah, everything's good. Happy to be here. So
We're excited. So let's just jump right into it. How has this current social climate impacted youth?
well, let's go from a personal um kind of standpoint first. It is stressful, okay? I think my anxiety has been a lot higher just in terms of if anyone else has mild, severe, whatever anxiety, you know that you like to know what's happening. And a lot of things are just out of my control. So I think that has whew, been played a very significant part of how I'm reacting to things.
Mm.
Just not being able to control whether that's from the racial tensions that we're having, the political tensions, and then you bring about the professional stuff. I mean, as a nurse working in this pandemic, I primarily my background is with children. So at one point they were furloughing people, which is crazy. Like, it's a pandemic, you would think we need nurses, but you find that that's not the case. A profession where you would think you have job security, and that's not, ideal. So from a professional background, there's been, just some uneasiness. You go into nursing not thinking you're going to necessarily deal with a pandemic. So how do I prepare? How do I calm my nerves? And then anybody who knows your nurse gonna ask you, so what should I do? How do I do this? How do I do that? And I don't have the answers either. Like,
Mm.
so I think that has been kind of interesting. People wanting your opinion. Should I go to this party? Should I not? Should I wear a mask? Should I not? Like, I don't have the answers for you. I can only tell you from my personal, opinion and the research that's out there. So, girl, it's been
And
crazy. It's been crazy.
that sounds crazy and super overwhelming. And first of all, thank you so much for even putting yourself in that. My mom, she works in the medical field as well. She's a dietitian aide, like she serves foods to the patients. She works in food service, I should say. And she's been working there for 30 years. So, and I've heard all these stories. Like, she worked through the AIDS epidemic. She's working through this, and my mom is 60 years old or 61. So, I hear those stories, and I really feel for you. And I thank you so much for just being out there too, because I see what my mom has gone through. So I can only imagine what you're being going through. So thank you so much. How do you deal with that overwhelming feeling? Like, who's there for you when you're having those moments?
um I think, I mean, what do I do to deal with my stress? And it's crazy because I'm still what I call a baby nurse. I've only been a nurse for 3.5 years. Had a lot of kind of professional experiences. Like, I travel nursed. I've done ICU nursing. I've done med surge nursing. And right now I'm doing outpatient nursing, like primary care, health, and that kind of thing. So um, it's crazy because in my very first nursing professional whatever interview, the lady was like, so nursing is stressful and we just want to know, like, how do you deal with your stress? And I'm just like, what kind of interview question is this? Like, mind your business. But like, it's so true. Like, it is very, very stressful. And I really had to dig deep. Okay, like, what are my coping skills? So for me, it's been working out, reading, watching Girlfriends right now, a little
Mhm.
Netflix binge, and really just making sure I'm taking care of myself. And the things that I think that I was doing for self care, like getting my nails done or getting a pedicure or getting my hair done, like, that wasn't self-care, that's just maintenance. And until I looked at it from that perspective, like what am I doing to feed myself, my soul? Like what am I doing to regroup? Um, like I was just bottling it up. Like I was walking around like real like pressed and very heavy until I started to, make those adjustments. So
That's great.
Wow.
Thank you for
Like,
sharing. That's just so real.
right. Because I can say the same thing about it's like the maintenance part. It's like, oh, I get my nails done. That's my self care. But it's like really, I'm just maintaining. What am I doing to feed my soul? So I actually like really appreciate you saying that, 'cause that's a reminder to me to go above and beyond to figure out what I need to take care of myself. But just thinking about everything you said, and obviously I've known you for your whole life. But what made you become a nurse? Why did you want to become a nurse?
So I knew from early on, I actually wanted to be a doctor. And I feel like most people like, oh, the nursing world, like, oh, you want to be a doctor? Why weren't you a doctor? Because I was a single parent household and we couldn't afford it. Like, let's just be, let's be real. But from an early age, I always knew I wanted to go into healthcare. Like, I liked taking care of people. Um, I remember my grandfather. Like I used to like help him count his pills. Like my grandmother was sick. I remember like putting in her eye drops for her, and I was like, this is kind of cool. Like I can get jiggy with this. Like I get paid to do it. Like all right, like
Oh,
here I am.
see, I didn't think about that because my grandparents had me doing all that shit too.
Right?
And now I, but that's how I used to get my $20 at the end of the week. Like that's how I got.
Got to raise the bar. Raise the bar.
Right? Now, if I help you go to this grocery store, I want an extra 10, Grandma.
Like we was free labor. We were free labor.
No, I wasn't
Um,
playing that.
but no, seriously, like I just liked taking care of people. So I always used to say I wanted to be a pediatrician. I wanted to be a pediatrician. But then I remember my junior year of, high school when it's like, okay, you need to like start to narrow down. What do you want to do? What are you applying to college for? And like med school, y'all, I'm talking, it's 4 years for med school. You do, 4 years of undergrad, 4 years of med school. You have to do a residency. And then if you wanted to specialize like I did, that's an extra 3 years. That's 14 years of higher education. I was like, I just, it's just not likely. Like I struggled doing the 4 years of undergrad. Um,
Tell
so
me about
nursing, yeah, sure. I went into nursing because I felt like, I shadowed a few nurses just like my junior year. I'm like, okay, like I know I want to get into healthcare. I know I want to do something in that realm. Like, and not even like it's a step down from being a doctor. It was just more so like I ended up connecting more with that role. I liked the face to face care. I didn't like the idea of bopping around to 20 different rooms and juggling all that patient information. So I chose nursing because I wanted to connect with people. I wanted to be that face that you see. I really just feel like I was making a difference. And I mean, it kind of worked out either way because I started my nursing career with kids. So like I got the pediatrician role of it where it was just more beneficial. It was more heartwarming to me. Like I love what I do. I love the kids. I don't regret becoming a nurse any day, honestly. I regret the loans, but it was the best thing I've ever done.
We all have the lone story. We all have the lone story. Right.
uh, which I'm still going through the loan story.
I feel that.
And I'm sure your loans are much bigger than much more than mine. So like that's
Added on to them with grad school, so
is do
I
you
don't know.
do you get help for like those loans because you're working in the health field? Like is there resources for that?
So, I mean, a lot of jobs, like I kind of knew something about like tuition reimbursement. Like I looked for that when I was applying for professional, jobs. But you get like loan forgiveness through like the government programs or whatever. But I feel like you can't bank on them, especially with our political climate, everything kind of up in the air. It sounds good. I pay my loans for 10 years, you're going to take care of the rest. Cool.
Mm.
But the reality is that is not always the case. It's a long application process, etc. They have these other programs like HRSA. I don't know if you guys have ever heard of it. So pretty much you work in like nonprofit areas, and they'll pay for your loans, which also is cool, but it's very competitive. Everybody has loans these days, so it's not even necessarily a first come first serve. It's a who needs it the most. And I'd be looking at my loans like me, pick me, but I mean, there are other people who have substantial. I mean, I think, and really, what somebody told me is they do it based off of people who have their masters first. So hopefully when God puts me in that number, they'll think of me and pay for my loans.
Right, but that's just so crazy that you are on the front lines and they're putting you through hoops, but then they can pull out $2 trillion out of nowhere and divvy it around, and
Whew,
that there's money there that they can just give to this medical field that is literally
On the front.
out here on the front line saving us. I think that's so bug to me, and that was one of the issues that I had about the whole COVID situation when that stimulus check hit. Like, wow, there has been money out here this whole time that could be paying back our loans and help and giving the money back to us. I never even thought about the amount of money is taken out by people who work in the medical field.
right.
I just always assumed that you guys would take that money out and you guys would get some type of, because you've been working in this field such a long period of time. The fact that you have to go through that many hoops,
Mhm.
it's crazy.
The
Right.
crazy thing is, I think people think nurses make a lot more money than we actually do. I remember talking to Shannon when I was applying for this new job that I'm in right now in the outpatient health field, and I was like, "Yeah, they only start us off at like, let's say mid 20s just for ha-has," and we're just not. That's not true, but I'm just saying just for
Oh,
ha-has.
Yeah, so it wasn't that low.
Like just for ha-has, and they're just like, "Oh, like you're not making $40+ an hour," and I'm like, $40 where? Like where?
Right.
Like it's we really don't make the money I feel like we deserve, and I don't know if that's because we don't have unions. Like nursing unions used to be a thing. For whatever reason, they got rid of them. So a lot of the places that I've worked are not union, so we don't have that kind of support to fall back on. But we truly don't get the money that I feel like the work that I'm putting in. Like I'm working 12.5 hour shifts. Sometimes I don't pee. Sometimes I don't eat. I'm dealing with cranky parents, cranky children, and like I just don't think people realize like how much we give. Like not only am I thinking about my next move in terms of keeping you safe, keeping you alive, what can I do to improve? And I'm speaking for myself because maybe not all nurses like operate this way, and it could be like where you're at like in regards to a setting, but I worked in the ICU, so it's just like, okay, cool, if your heart rate is this, I need to be thinking about my next move and to do this. If your oxygen saturation is this, I need to be thinking about this and what I'm going to do to improve that, or whatever the case is, or manipulate your ventilator. And then it's just like, okay, what am I bringing to the team, because I'm your first advocate. If you can't talk to me, if this parent has never been in the hospital setting before, like not only do I have to relate, but now I have to be your educator. I have to be your advocate. I'm your support sister. I'm the shoulder you're crying on. And it's just like, okay, this kid hasn't gotten out of bed today. Like, what am I gonna do to make sure they're safe, but like they're still moving and they're not, like their muscles aren't getting weak, and that way they can be a normal kid when they're out of here. Like it's a lot. And then you've got coworkers who you're helping out with your own stuff. Then you got the social issues, and it's a lot. So when I go home and I'm like, wow, I'm exhausted. I don't have any energy for my
damn,
family.
you have to give me an anxiety attack.
Right. Right.
It's a lot, and I don't think people, like, we definitely don't get paid. And then you add COVID to it. Nobody
Mhm.
knows what they're doing, in my humble opinion. As someone who's on the forefront, we don't know if we should be wearing respirators or surgical masks. We don't know.
Wait, now what
Sorry,
do you mean you don't know what you? So there's no real instruction there, or you just not feeling like those mandates are.
it changes every two
Right.
seconds, and this
Mm,
isn't to mock the healthcare field. It's really just nobody knows.
mm,
Nobody knows. At first, people thought this was transmitted on your clothing. It was like, oh my god, now
right.
got to be Lysol everything. Come to
Right.
find out, that's not the case. So it's just like everything. It just changes. Like, do I feel safe as a nurse going into work? I mean, yes. I mean, I wash my hands. I wear my mask. I'm doing what they're telling me. But it's just like I feel like there could be more. Like, what if
Hmm.
there's something we're missing? Like, the CDC says they don't recommend giving a flu shot if you have COVID symptoms or are being tested for COVID, regardless of the case. People are at places getting COVID tests and getting flu shots at the same time, and it's just like the information just changes. I think sometimes it contradicts itself. I think the CDC doesn't necessarily know what to tell people, and we're winging it as best as we can. But then you've got the people on the front lines who are like winging it, like,
Right. Right.
hello, like I'm in this person's face, I'm trying to feed them, and then they come back COVID positive. And I
Hmm.
don't feel like there's a good way to tell these healthcare workers
Right.
that they were exposed. Like I had a
Hmm.
baby, I was in the NICU, and for those who don't know what that is, that's the neonatal ICU, and the mom winded up getting a fever after delivery. Like she wasn't able to come down yet because of XYZ. They thought, moms get fever sometimes after delivery. Like you never know, it could be like she had an infection brewing, whatever. She tested positive for COVID, but had already been down in our unit fraternizing, holding her babies, and I'm, breastfeeding her babies, and I'm all in her face, all in her baby's face that she's been around, and nobody said anything. So it's just like,
Right.
don't standardize anything, in my humble opinion, about how we're handling COVID, how we expect healthcare people to handle COVID, and how we're keeping everybody safe. Like, yeah, wear a mask, cool, but it's just like now there's this information that you need to wear goggles and an eye shield because it can get in your eyes. Where
Mm,
was the data for that? Where was that coverage on the news? Like,
right.
we'll be wearing these in grocery stores. Like, what are we doing?
And this is me and Shannon just was talking about this before you hopped on about how Trump was so fucked up. That was the one thing that if he could have just figured out that he had scientists and he has access to all this stuff, and this stuff should have been figured out by now. And that's what's so fucking crazy because I didn't even think about things like examples like that. Like that's just absurd.
I mean, I know for me, obviously, I've talked to you offline, and I've talked to, Josh, my fiance, who's also in the medical field. And I feel like there was just a lack of resources in the beginning. So a
Mhm.
lot of the times you guys didn't have the gear that you needed or the PPE that you needed. So you guys were going in kind of blind or exposing yourself to things um, before there was even a solution or even like a makeshift solution for you guys to actually do your jobs. And so did that kind of impact your level of trust? Because I feel like that was a thing of like, you're not protecting me as an employee, but you want me to come to work every day.
Mm,
And
Sure, for sure. I think even like when we ran, like, how do you run out of respirators? Like,
right,
mm,
and you have me wearing one that does, like, if for those who don't know, respirators, you shouldn't just be buying them off the street or online. That's something you are literally fit for. They're fit for your face, and there's a variety of sizes. Literally, there's a test that you do. They like spray some stuff in this hood, and they're like, if you can taste this, this mask doesn't fit. They have you do all these crazy movements. You bend over, you move your head side to side. It's not just like a light thing because God forbid it is a disease that is transmitted through the air. They want us to be protected, but to think like they had us wearing stuff like sizes that weren't the right size, these generic brands, like how is this, protecting me? You want me to work, you want me to show up, but it's just like, so I think like there was a little bit of or distrust in our employers and the healthcare system.
right.
Um, and then like there's just no compensation. Like why is Home Depot giving their people extra $50 a check or whatever, and we have
mm.
gotten nothing. We've maybe gotten, and not to speak for all nurses and wherever they're at, I've got nothing. Maybe a coffee from the manager, like they bought a coffee cart. Gee, thanks, bro, but I don't really want to take off my mask to do this. So, um, I just don't think there's been any compensation. I think the healthcare heroes stuff, that's cute, that's nice. Like, thanks for all the signs in your yards, but it's just like I think it just speaks to the bigger issues. We're not paid enough. I don't think nurses are respected. I don't think we are valued. Um, I've literally had a parent like cuss me out because they can't have their cousin, their third cousin, the grandma, whatever, come visit their kid in the hospital. I'm like, ma'am, it's a pandemic. I understand you want to visit, but it's just like
Right.
what can I? There's only so much I can do. Like not only am I trying to keep myself safe, I'm trying to keep you safe and the next safe. So I think it's just yeah, they're gonna have to. I don't
I
know what the answer is because I feel like you've got places that are union and places that aren't. You have people who take care of kids, people who take care of adults. Like luckily, like I said, I work with kids, so like we had furloughs because kids weren't being affected by COVID in the numbers that we thought they were. They winded up this weird rash winded up coming about that was like a byproduct of
mm,
COVID that we were
right.
dealing
I
with,
remember that.
Yep.
but it wasn't COVID. Like we were like ready. When I tell you we got all them kids out the hospital that we could, like empty bed, like our PICU, like they were empty. Like we were in preparation of this influx. And then when Hartford got hit, we even talked about getting taking some of their younger adults just to care for them and put them on our vents and stuff. But it never came to that. So I think like it's like the answer is different in every kind of setting of nursing
Right.
in terms of compensation and appreciation. We have COVID kids now, not in the numbers that we were seeing when it first happened, but yeah, I don't have an answer. Like
Yeah, Taylor, I think that they depending on your percentage of COVID, and I'm only going based off of what Josh told me, there were places that gave bonuses, but I'm talking about like $50.
Yeah.
Yeah.
Not an hour, but like just 50, something like simple like that. And I will say I didn't understand the underappreciation for nurses until I gave birth to KJ because I remember because I was like, oh, my cousin's a nurse, and I had like gratefully I had an amazing nurse. Let me tell you, the nurse did all the work.
Yeah.
Like the doctor came in when KJ was crowning. Like there was like they just pulled the baby out. She had done all the work. She had done all the pre-work. She was checking. She was amazing, amazing. Um, and so that was a level of respect. I'm like all the stuff that she did. She was there at labor, and I don't want to get too graphic, but she did all the work pretty much. Um, and so at that point, I realized like the doctor comes in and does like I just felt like the person that's the bedside manner, the person that's always there is the nurse. But I've also seen like really horrible nurses. But I feel like the level of care and the level of work that they put in is like I don't want to say equivalent to a doctor, but equivalent to a doctor. You know what I mean? Like the doctor gets all the glory and all that stuff, but the nurse is really doing a lot of the brunt work. And so that made me appreciate that job even more because she literally was amazing,
What's crazy
didn't
is
have any issues.
in grad school, I actually just did a paper the other day. Like, there is no way in most facilities, and I've looked in Connecticut, there's no way for us to bill for our services, what we're doing as nurses.
Right.
And I think that's what makes it difficult, not necessarily for the profession to have respect, but for people to like realize like what it is we're doing. Like the vitals, whether it's assessing you for your contraction, Shannon, like I'm doing all that, and then I'm
Right.
relaying to the doctor who comes in when it's time.
Right.
So it's hard, but like the doctors make the big bucks
Right.
because
Right.
I just don't know if it's as a profession we haven't figured out how do we bill for everything little thing that we're doing. You know what I mean? And then would that change our pay? Who knows?
Right, yeah, you just pay people more. I think that this goes back to the same wise old tale of people who do the most work get paid less, and people like to act as if they don't know that people are doing this much fucking work. If you know every I'm sure every task that you have, every baby, there's one standardized way of delivering this baby, and then you have to add on to that because there's all these varying uh case by case basis. So I think that people know. This just goes back to how life has been where we do so much fucking work and get paid less for it. And then we have to keep continuing to vouch for our actions and vouch for ourselves. No, people see the work that we're doing. And it's frustrating, that we have to now you have to question your work and what you've been doing. You're freaking birthing babies. People are putting in so much that it's fucking sad that we still have to vouch for ourselves to question why I should be getting paid this. Y'all should be getting all the money in the fucking world.
I wish. I truly think nurses, like new grad, like I was a new grad, and I think I started at $29.50, which is a lot of money to someone who, fresh out of college. I'm
No,
like,
it's not. No, it's not. No, it's not.
and it's
Like,
not. I say that now as I'm
yeah,
paying my student loans. I'm like, I need about $50 an hour to start. Like, Jesus.
right. Yes.
And then you add like the cost of living in Connecticut. I'm just like, I literally can't afford a child.
Preach, Taylor. Preach.
I can't afford a child. Like I could barely afford. We just bought a house. I'm like, God is great because I don't know how we did it. Like I
Right.
have student loans. And when you're paying $1,000 in student loans a month, like it doesn't leave much wiggle room to live. So
Taylor,
I don't
you
know.
are preaching.
Who do we write a complaint to? Like,
But
Right.
you know the crazy thing, and I'll say this across any industry, and I told you, this is like anybody under me in my family, this is a conversation I have, and I've had it with you. Like, there's always more money on the table, majority of times. And when you come out of college, because I was saying, I came out of college with a degree, like, I was making $15 an hour, houseway in Connecticut.
yeah,
And so my whole thing was like, oh, great, I have benefits. Great, great, great. Not even understanding how underpaid I was.
Mm-hmm.
How underpaid I was. I had someone that didn't have a college degree that was making um, $7 more than me
Hmm.
an hour.
people
So
people don't talk about how much
Mm-hmm.
they're making. Like it's so
it's
taboo.
like it's supposed to be a secret.
It's not a thing. Like if you
Yeah.
talk about it, oh, it's hush. No,
Yeah.
no. Because I started, probably my fault. In my old job, I was like, so how much are you making? And that
Hmm.
was one of the big reasons that I left. I'm like, I got all these certifications. I have more experience than you do. I work in both ICUs. Like I'm a critical care float pool nurse. And I'm making this and you're making
Mhm.
you I was like, goodbye. I'm done. No, no. I deserve way more. Way,
Kudos.
way.
Kudos.
I was like, I'm not doing this.
I feel like we need to get to the point where we're doing that more because I feel like there's always more money on the table. One, you should always ask for more. If they say no, then that's their best offer. But I feel like we as Black people just take the first offer because it's like
Mhm.
it gives us the package. We think of the package when it's really like I'm starting to think about my worth. And I know all that I bring to the table and I want more. And I tell everybody in my family this now, always ask for more. There's always more. If they say no, then that's what it is. But at least you asked and you have the option to ask. We could talk about money all day. But I speaking of money, I do want to get this question out because I've seen it firsthand. The different levels of care based on your insurance and or money,
Mhm.
right? How does that impact you? Because I feel like for me, just witnessing it, it made me feel so like everyone should get the same level of care.
Wait, do you have an example of this? Because I didn't even think about
Yes, I have a prime example. I have been in many deliveries. I know the experience I have. I know the experience of the nurse I had, the doctors I had, and my insurance. I have been in other deliveries, and that level of care was not given to the point where no one checked until the baby was crowning. So Taylor knows, but I just and it's like, but I've also seen other levels where it's like you go to get it, and the checkups are different. The levels of what they do, and obviously it depends on the doctor. But I also think it has to do with your insurance.
that.
Sorry, Taylor.
Hands down. It's a true thing. And it might not be like, oh, it's so obvious, like I did that because this person gets Medicare or this one's on Husky A or whatever the case is. But um that was also one of the reasons that I actually left my old job. And I don't know if like I would like to think people aren't like that. And it's
Right.
not coming from that place. But it's just like I had a patient, very, very dear to my heart, uh, who little girl, 7 years old, had a friggin' heart attack because she had a pacemaker, and it misfired. Gave her a heart attack. She's in the hospital, going home. She's okay, thankfully, totally normal. Just whatever. God was looking out. Um, they didn't take out the pacemaker. They ran tests that it was fine. Cool. She's on going, about to go home. For whatever reason, it misfires again. Her mom happened to be out of the room, and she coded and was down for upwards of 20 minutes, and wasn't looking good neurologically. Came down to my PICU. I'm taking care of her, and for the longest time, they wouldn't do a particular scan that she needed to see like where her brain function was at. And I think they blamed it for a while, but she was down there for about 3 weeks, maybe like the first week and a half on this pacemaker that she had that they never replaced, and I felt like they should have replaced to begin with once it misfired the first time, not the second time, the first time. Um, and they couldn't do this test. They couldn't do this test, and mom was getting so like disheartened. Like, why can't they just do this test? Replace the pacemaker, do this test. And it was to the point where she wasn't participating in rounds, which is what you do. You meet with all the doctors. She didn't want to talk to any doctors anymore. She's just like I want to know my baby's still in there. Like I see it. Like, but can y'all do this test essentially? And it wasn't until long story short, they never do the damn test. They wound up replacing my pacemaker after she was sitting in the PICU for 3 weeks, just doing nothing, literally just laying there. And me just out of curiosity, I'm like, I wonder what insurance she got. Like, lo and behold, it's state insurance. And I'm like, I can't help but think or see because there was a similar case down the hall where they took whatever out immediately, got that test. I'm like, I
Mhm.
understand that this stuff is expensive and reimbursement issues or whatever, but it's just like she didn't have to lay there for 3 weeks. She didn't have to literally, not deteriorate even further, but like get so weak that she's been in a bed and we had a breathing tube in her mouth for weeks. And it's just like we could have done the test and replaced the pacemaker and like done all these interventions. It's just like, but there's only so much I can do as that advocate. So it's just like I don't know if it's a reimbursement issue in regards to the hesitation on why we don't do certain things. I don't know if it's just doctors thinking a miracle is gonna happen or we can do XYZ first before we do this test. But I would say like even like if you look at outpatient doctors, they're like, oh, we have our quota for Husky A, or sorry, we have our quota for Medicaid, so we can't take you. Versus having insurance where you get your money back and whatever. It's not fair, and I've seen it firsthand.
Yeah. Like I don't even the insurance talk is so deep, but to me it just to see it and if we go into the racial disparities of it all, it just is really sad to see because everybody, if I'm coming to get help, should be helped.
Right, I agree, and I don't think that's always the case. I think people assume if you are black or some sort of any other minority that you have the state insurance, that you can afford XYZ, and it's just I just I don't think that, or even in like the NICU, I've had a case where and I don't know if it's just like an education thing, if people just don't know what to advocate for, if the nurses aren't working. I mean, like I said, I think every nurse is different, but like I'm looking at all the whatevers before we do something, something crazy. So like this one lady allowed her baby to get a trach and all this other stuff. Like he has like a feeding tube, and this white family, literally similar thing, delivered early at the same time, same kind of prognosis, same kind of um path or course that they were both on, and she refused. Hands down, she's like, "No, we're gonna try this, we're gonna try that." And of course, she had insurance, and so they really had Medicaid. And they're just like, "No, we'll give him a trach, send him to XYZ, and we'll move on." And homeboy like went home just on oxygen and whatever. And I'm just like, I don't know if it's like I said, an education issue if people just aren't fighting along with them because of
Mhm.
their insurance and whatever, or if it's because this white lady, same age, whatever, just happened to have insurance and happened to, know to Google things or know to ask or whatever the case is. So,
I also think it's a asking thing of you're trusting your doctor.
Right.
You're trusting the medical professionals that you have there. And not to say not all medical professionals don't have your best interest, but it's okay to ask why. Sometimes we don't ask why or what does that mean or is there other options? Like we don't know, I call you sometimes like, girl, they said this. What like should I?
Right.
Um,
And you just gotta vouch for yourself. Like you have to do that research and that education on your own because you can. I find sometimes we put ourselves in situations, especially as Black people, we still ask and still get the runaround, and then you have to really arm yourself with as much education project, which is fucked up that we have to do this extra step in something else too, where it's literally our
yeah,
lives on the line.
but then it's like you're aggressive, you're that difficult to whatever parent or black person, and I just think like in healthcare, like there are those like untalked about biases, like, oh, why does this person want more pain meds or whatever the case? I just gave it to them. Like, number one, they teach you in nursing school, pain is subjective. Like, it doesn't matter what you think it is; it's what that person thinks it is. So even though, and I feel like sometimes we just like we're so by the book in healthcare that sometimes that doesn't work, and then so we get annoyed when we feel like it inconveniences us. But at the same time, like I think it's up to us to be like, if that's not what it's about, it's about this person who's in front of me. So quiet, quiet. So
Yeah,
uh,
please always keep that mentality because I've heard the horror stories of also nurses and like you said, how they treat people or just from what we're talking about. So you keeping that mentality it gives us a little hope.
yeah. And you know what, I'll close with this because I think that this was such a great conversation. I think that Black people are scared of the health professions anyway, and they're scared of some people are scared even going to the doctor because of the things we're talking about. But I feel like, having you on today and understanding that we need more Black medical professionals like yourself to be advocates and at least to have your patient's best interest at heart, regardless of the race, regardless of, the insurance and things like that. So I just want to applaud you for being an advocate, being on the front lines, putting your life on the line, especially in this pandemic. Um, I don't think you guys get enough flowers. Um, but I just want to leave it with that and just say there are advocates out there like yourself. I hope that there is more in the future. And, we love and adore you.
Yeah, we do. 'Cause this was such a pleasure, and like I thank you so much for just for being out there and
Right.
doing putting in that work.
So I know that, I mean, obviously, this is a health specific episode, but where can people find you, and or if you want to even include some medical resources that people can do to check on their COVID or just health related things, like sites that they can check for themselves, whatever you want to provide today for people to connect with you or just connect with the right health resources.
Yeah, so I'm kind of boring on social media, but if anybody ever wants to, inbox me, ask me, a healthcare related question, and even if I don't have the answer, I will try to find one for you. I'm on Instagram. It's underscore TTAYLOR. Um, and then even though, like I had mentioned earlier, not that the CDC isn't credible, the information does change hourly. So I would just recommend just following up with the CDC. That's kind of the one database that the whole world is watching in terms of COVID. It's what my jobs reference to the best of their ability as well. So if you're looking for COVID information, I would check the CDC. Be mindful of your state's Department of Public Health website as well, just because sometimes there are some state specific mandates on there as well. So yeah, if anybody needs anything, let me know. I mean, I will try to be as helpful as possible.
Oh, thank you so much. This was so good. I feel like I just went to school and learned more stuff about the medical profession. Thank you guys for listening. This is another Speak Out Sessions for the book. Have a good day, guys.
Talk to y'all later. Bye.